Spotlight, where every week we are interviewing the most amazing private practices all across the United States. Every week we have someone here that's new, that different specialty, and most importantly, bringing a brand new perspective for us here to learn about. So I would really love to introduce you to someone really special and amazing, Dr. Richard Way. He is the owner and CEO of Care Medical Group in Washington. So, Dr. Way, thank you so much for joining us.
Well, thank you for such a great introduction. Much appreciated. And yeah, I'm excited to have an interview with you about my practice.
Yes, I know that we have so much to dive into today and a lot to talk about. So I would really love to start off, maybe even just hearing about your story. Like what had inspired you to open up your practice? I mean, I'm sure you've done so much in your lifetime that has brought you here today. So would just love to learn a little bit more about you.
Sure. I think I should probably start when I was in utero in my mom's belly.
Oh, we're going all the way back.
Yes, and she had a tape recorder taped to her belly, and in a really deep voice, there was "You will be a doctor. You will be a doctor." And so for 9 months, I heard that in my mom's belly. And then when I was born, she put the same tape recorder under the crib. And so while I was being raised, I heard, "You will be a doctor."
Oh,
And then one day, when I was 6 years old, my mom asked me, "Hey, Richard, what do you want to be when you grow up?" And I just automatically said, "I'm going to be a doctor."
you sure
So,
did. That's
for
exactly what
whatever
you said.
reason, that was brilliant of my mom, and here I am, very happy and proud to be a physician, and being able to save lives was really important. And so I did all my training in Chicago. That's where I was raised, outside of Chicago. And then from Chicago, then I went to New Orleans, and that's where I started learning about business. I did get a master's in public health with a focus on administration, as well as my medical degree and my various specialties as well, which I did most of my training at Northwestern Medical University in Chicago. And so when I was in New Orleans, first of all, the food is amazing, the culture is amazing. But I joined a practice where they made me a partner within 1 year, which is really a fast track.
Super.
But I did a lot for them, though. It was two general surgeons that had a general surgery practice, but they were just starting out in terms of like urgent care and occupational medicine, and that was my background. And so I developed the program. We got a helicopter service to bring in injured workers from the Gulf of Mexico. We partner up with a hospital in terms of getting the helicopter service. So that was pretty exciting. And then I built one clinic to around five clinics or so, and bought some physical therapy clinics as well.
That's amazing. I mean, for maybe a lack of better words, you were born to do this, literally from your story about your mom, who just sounds like an absolute genius. And that, I mean, truthfully, it's super neat. I mean, it's really nice to have a parent that was thinking so much about your future and wanted you to have such a great future and career, to building that and to follow in those footsteps of what you learned as a child to creating really amazing programs, when you were in New Orleans to being out here in Washington. And
Mm.
that it kind of leads me to, you're pretty unique with what you're doing out there.
Thank you.
You
Thank you so
handle,
much.
yeah, you handle a lot of patients. You do a lot of different things, a lot of services underneath one roof. And so I'd love to know what are some of the different services that you do provide? Because again, it is very unique and not everyone offers all of these things under one umbrella.
Sure. And so in New Orleans, we offered ER consultations. We were involved heavily with the emergency room with big traumas. Um, we have x-rays and we had labs as well.
Mhm.
Um, But unfortunately, in New Orleans, Hurricane Katrina came along,
Yeah.
and that was devastating. It destroyed a lot of my clinics. It left a few standing, which was fantastic. I was able to rebuild those clinics, but I knew that it was not long standing because it had gotten pretty dangerous in New Orleans. I mean, oh, I can't tell you that one day, I was occupational medicine director for the police department. And right after Katrina, while I was seeing a bunch of patients, one of the detectives showed up and asked me if I had a gun. And I said, no, I've never shot a gun. No, I'm not interested in a gun. He goes, well, I think you probably should get a gun because people are robbing clinics for drugs. There's barely any law there. The police department was overstretched. And that's when I started thinking, maybe I should start moving because it got so dangerous there, right? And so as a result, I moved to Bellingham, Washington, um, more because of my boys, right? The boys were really young when I was in New Orleans. I have two amazing guys, and back then though they were 2 and 4 years old. But after Hurricane Katrina, they developed horrible breathing. They were allergic to the mold, which was everywhere. And so every night I had to create almost like a, ER atmosphere in my house with an oxygen tent, albuterol nebulizers to open up their airway so they can breathe. And so decided to look for a clean air city, and lo and behold, Bellingham, Washington was that city. And there was luckily a clinic that I can purchase. And that's how I ended up in Bellingham, Washington with this fantastic clinic. And so, what it does provide, right? My whole concept has been to make it convenient for the patients when they come through my clinic. And so, instead of going from point A to point B to point C to point D to get all the workup done, in my clinic, I provide not only great patient care, but also x-rays. I have in-house x-rays. I have in-house lab draws, for chemistry and CBC and diff and things of that sort. I do in-house urine analysis. For my acute patients, I run in-house troponin levels and D-dimers,
Yeah.
CLIA approved lab, obviously. But I also do pulmonary function tests, respiratory questionnaires, respiratory fit test, audiograms. So it's all under one roof. And I think patients and companies love that because they don't have to travel everywhere to get all the other procedures done. You can do it all in my clinic.
There, it's amazing what you've built, and all the things that you took from what you learned in New Orleans to Washington, and there's a lot to unpack here. I mean, clearly you're very much family oriented, and I can see how much you pour that into your patients and what you've built,
Mhm.
just in how you cared for your boys and have moved to a whole new city, purchased a clinic, and then decided to not only build things for them but for your community. So there's a lot to unpack, but then there's also a piece of what you left in New Orleans is that there's not a lot of visibility as to what other providers go through. To think that you had needed to purchase a firearm to,
Yeah,
you know, run a practice, you didn't think that would be a requirement
right.
in order to.
Right. And to tell you a horrible story is 2 weeks later, one of my friends who is an OBGYN actually shot a perpetrator in his clinic while they were robbing him. That was insane.
They don't teach you that in medical school, I can assure you.
Yeah, they don't teach self-defense in medical school
I don't
or
think
how to use
so.
a gun, right?
Yeah, and so, for everyone here, this is an incredible story of, going through hardship, but finding something that you can pour your heart into to care for your community, to care for your family, and do something really great. And it's so awesome that people can come to your clinic and get taken care of in all different ways because you know how healthcare is. It's so broken and broken up.
Yes.
And so
It's broken up. I should say it's
it's
fragmented.
fragmented. Yeah.
That's correct. And it's unfortunate, but hopefully there's going to be solutions that can help, decrease that fragmentation and really help the patients more than anything else, for
Yeah.
sure.
And I can see that you're really doing that. And I would love to hear, what is your real approach to care and how do you feel like it's different amongst, what's out there today?
Well, my motto in life, right, is do no harm,
Yeah.
Hippocratic oath, but also to take care of my patients, right? I think that was what I was born to do. That's my passion is saving human lives, making them feel better from their illnesses or their injuries.
Mhm.
But above all else, I think it's this motivation, this drive to help patients out. So for example, if we get back to New Orleans, after Hurricane Katrina came along, so many doctors and policemen and firemen left the city. That's why it was kind of dangerous to be in the city at that point. But I stayed because there wasn't really any clinics around, and I was seeing by myself probably 100 patients a day, and I was open close to 12 hours, 14 hours a day
Mhm.
because Hurricane Katrina was just devastated everything New Orleans. I was living with a friend, a couple actually, they're amazing people. And I was traveling probably close to an hour and a half to
Mhm.
get to my clinic. And so, I was barely at this place. I was there for maybe 4 hours of sleep, waking up, driving down to my clinic, seeing all those patients, then driving back. But the saving grace, a little human story here is that the gentleman, and it was actually um, a friend's roommate's parents that I stayed with, and he had retired, and he was a chef by hobby. That was what he loves to do is cook. And so every night I would come home after working God knows how many hours, and he would have this amazing dinner for me with a chalkboard saying, here's your dinner tonight, enjoy. Ah, that was so touching. And that's what life is about, right? It's about give and take, about compassion, but motivation and drive to follow through with things.
Absolutely. And I see that passion and I see how driven you are, but thorough. Like everything that you've done has been very methodical and how you wanted to open up things, how you wanted to bring certain services to the community. And, with all that being said, it's great today. There's so much technology. There's so much to be done in healthcare, but I think can often lead to a lot of misinformation. We have, not only just Google now, how fabulous
Yeah.
that is, but ChatGPT and, TikTok and all the things that people have to say on there. And there is a lot of information. It's good that people are invested in their health. I find that, I'm sure you get questions all the time, Dr.
Sure.
Way, I had seen this or I read this article or someone told me about this, which is exciting. But at the same time, I'm sure you field a lot of questions that are maybe old wives' tales, misconceptions about what you do. And I'd love to hear about some of the things that you are debunking on a day-to-day basis.
Yeah, I mean, my best friend, Dr. Google, right?
Yeah.
My patient's best friends, I should say, Dr. Google, they come in with a lot of myths. But I'll discuss two of them that come to mind. The first one is, oh, doc, I've got a cold. I want an antibiotic. And
Mm.
so typically, I'll have to educate the patient that if you have a cold or a flu, which we can test for in the clinic, you know, flus, COVID, strep tests, that's all done in one panel. And based on what the information provides me, if you have a flu, an antibiotic will not help. Antiviral will help. So something like Tamiflu is perfect for the flu. Tamiflu, flu, you get that right.
Hmm.
If you test positive for COVID, at a certain age, if you're 55 or older, if you have a cough, then Paxlovid is the drug of choice to reduce the COVID virus in your system and save your lungs from getting a pneumonia. Now, if you've had a upper respiratory infection for over a week and we check your white blood cell count and they're elevated and you have some lymphadenopathy, then for me that's the point where I will start treatment with antibiotics. So
Sure.
that's a lot of common myths that comes in through my door, especially during the flu and cold season.
Yes. And I think it's such a great thing to note too, because I think people do drive, oh, I just need the antibiotic. And there's so many reasons of which you might say, no, that's not necessary because, we're in today's age, we're used to every, Amazon 2 day shipping. Everything comes immediately. So health must be immediate. I must feel better tomorrow, today. And, some of these things, might take its time a little bit more because the antibiotic is maybe not what you need. It's something different.
That's right.
So
That's right.
that's
And with all medicine, there's always, pros and cons to it. And there's some significant side effects of treating people automatically with antibiotics. And so that's a big stewardship that a lot of clinics have in terms of when to decide to prescribe antibiotics.
I
The
love
side
that.
effects, the side effects are such that, it can totally destroy your microbiome in your gut and cause something called C. diff, which is, just horrible, horrible diarrhea that you can actually get really sick from and end up in the hospital because of that. And then other side effects of antibiotics is certainly, a rash. You can actually, get anaphylactic shock from antibiotics if you're allergic to that and you don't know it. So it's not a benign medicine for sure. There's always things to look out for if you're prescribing these medications.
I think it's such a great thing to talk about because I think so many people think it's just an antibiotic, but there's so much more to it, for people to understand what they're putting into their body. And so I really like how you've broken that down because even if people know, they don't really understand, to the full extent. So I
That's
appreciate
right.
you giving us that tidbit and debunking, that myth specifically on antibiotics. And, to that point, Dr. Way, you've given us such great information today and so many things to take home with us. I'd love to get maybe some of your top pro tips, for actually both patients and providers. That maybe there's some quick things and easy tips for or homework that you can give to a patient that can move our health in a better trajectory. And then maybe for the providers that are listening, maybe they've been in business for a year, or maybe they've been a veteran business owner like yourself.
Mm.
But I always think there's something here for someone to learn at any stage of where they're at. So I'd love to hear Dr. Way's pro tips.
Right. All right. So let's start with patients first. A big part of medicine is the preventive side, is
Mhm.
how do you keep yourself from getting obese? How do you keep yourself from getting diabetes, adult onset diabetes? How do you prevent hyperlipidemia from developing? And so I always tell my patients when they come in for a preventive exam that to put their health as part of their daily lifestyle, not just something to think about once in a while when you get ill or injured, but on a daily basis, put that on the forefront. And so I advise my patients to follow the Mediterranean diet, right? Which, basically is eating, white meat, fish or chicken. Try to, cut down on red meat to maybe once a month, twice a month at the most. And then for every portion of protein, like the size of your fist, you want like 3 portions of vegetables.
Mhm.
This is the part that kills me about the Mediterranean diet is that you should probably cut out dessert. And I have such a sweet tooth. It is horrible and it kills me. But I do cheat though, on the weekends if I go out for dinner.
Yeah.
As my, friends know and significant others know, is that I will indulge in dessert for sure. But 5 days, 4 days, 5 days out of the week is I try to cut out dessert. So Mediterranean diet is important, right? You've got to move. Activity is so important. And so I try to advise patients to walk at least 3 to 5 miles a day, as much as they can. And it doesn't have to be all at once, but it could be incremental as well. And then along those lines, right, would also be for men, intermittent fasting. I think that really helps increase metabolism, but it also has amazing benefits with intermittent fasting where you have a window of eating only, like say noon to 6 p.m.
Mhm.
That gives you 6 hours of eating
Mhm.
and it gives you roughly 18 hours of fasting. And
Yeah.
during that 18 hours of fasting, your brown fat, your bad fats gets metabolized for energy. The most important thing is something called autophagy, which basically means that your body is looking for other sources of fuel and
Mhm.
it actually cleans up your DNA. It kind of eats away at the bad DNA and lets the good DNA survive so you become healthier as well and it'll boost up your immune system. So, I think women should be a little bit more careful with it just because of their hormone cycles, and they should probably talk to a doctor about when is it best to do fasting, if they should at all.
Mhm.
Um, and then the other thing is resistive training, for bone strength and muscle strength. I advise all my patients to do strength training
Mhm.
prevent if they fall, pathological fractures. So those would be my preventive advice for my patients.
I love
Uh,
that.
in terms of providers, right?
Yeah.
My best advice to them all, if they've been starting or if they've been in practice for years, and they know this at this point, but cash flow is key. You need cash flow. If you don't have the cash flow, then you should have enough capital to at least survive for up to 3 years. I think a lot of practices will fold in the first year because they didn't have enough capital to support the whole system for longer than, say, 3 months or 6 months because it is expensive to open up a clinic.
Mhm.
It'd be anywhere from half a mil to a mil to fully gear up a clinic to where you want it to be, especially at clinics such as mine, where, I have two procedure rooms, I have the x-ray, I have all the lab equipment. It's expensive. And
Yeah.
so you want to make sure you have the capital to not only fund the expenses, but the salaries for at least 3 years.
Mhm.
And and at that point in time, marketing is another big deal. Though I believe the best marketing is actually patient referrals. If the patients love you, they will go ahead and tell other patients to come see me. And I think the best example of that was one summer, I had a patient who had a big cut on her palm of her hands. I said, "Oh, how'd you hear about my clinic?" She goes, "Well, funny that you ask. I was jogging around the lake, Lake Patton. I tripped and fell and I cut my hand and I held it up and it was bleeding profusely. And then another jogger ran by and said, "Ooh, that looks bad. Go see Dr. Wei at Care Medical Group and he'll fix you."
Oh my gosh.
And that's how I got my patient. And so I get a lot of self-referrals from patient care, good patient care. And I think that's the best marketing ever. But don't forget about the internet as well. So I think marketing is just as important. And then lastly is treat the patients well. They will remember that and they will come back over and over again.
Yes, and I thank you, Dr. Way. And I think it's all like a cycle, even for the physicians and our clinical people that are watching. Do some of the things that you've given your homework to your patients about. Make sure you're eating well, making sure,
Right.
it's all a cycle because then if you're feeling great, you're gonna treat your patients great, when you're feeling up to it and you're feeling awesome and you have more ability to give and to share. And so I think everyone here can take a piece to learn We greatly appreciate all the perspectives and your story, and from your mom to what happened in New Orleans to opening up your clinic. This has been all fantastic, and we hope to have you again. Before we leave off, the last thing I'd love to do is for people to know how to reach out to get some more resources. So if you can share any of your resources with us and how they can touch base, that would be fantastic.
Sure. Yeah. So, my webpage is at caremg.com, and we actually have a lot of advice there that you could click on and read about your diagnosis or what you think is going on or what Dr. Google tells you is going on. And you can kind of educate yourself there as well. Uh, you know, my clinic number, I don't know if you want that, but it's 360-734-4300. You can call for an appointment to come see me, or you can do a walk-in because we do have urgent care in the clinic as well. So we'll see same-day injuries or illnesses anywhere from, you know, shortness of breath to lacerations to fractures to sprains. Um, all of that we can take care of for sure.
That's awesome. We appreciate you sharing all of your knowledge, your resources, and your time with us today, Dr. Way, and we hope to have you again very soon.
Thank you so much for having me on your show. You're amazing.